groups we were really trying to engage with were the 17 First Nations communities in the Interlake Eastern Regional Health Authority. We chose to work on connecting with these groups as a result of a community health assessment that was completed in 2014. The results of the community health assessment really demonstrated that there was a large gap in cancer screening among our rural, remote, and First Nations communities in the Interlake Eastern region. Collaboratively, we started a cancer screening working group. This was formed and included members from Cancer Care Manitoba, from Interlake Eastern Regional Health Authority, from Southeast Resource Development Council, Interlake Reserves Tribal Council, and the surrounding independent communities in the Interlake Eastern. Together, we worked with our partners to plan events and decide on a real trajectory of this project. In the end, we really gained access to the community health centers and their staff, and this provided a greater opportunity to engage with the community members as well. Our initial strategy included getting feedback from the community on cancer screening. So we started by engaging individuals with telephone conversations, just one-on-one, personal, private method to share their thoughts, and this actually proved to be a real success as people were quite comfortable to share when it was a one-on-one. Overall, it was a great way to gain some information from the community members. And then through this one-on-one engagement, where we were able to really get some perspectives and folks were able to identify barriers to why they might not be participating in colorectal cancer screening. And then this really helped us with the trajectory of our project and help engage the communities in screening overall.
We couldn't have accomplished as much as we did in the project without everybody's participation. This is a really key example of how much you can do when everybody works together.
When it came to pivoting our project around the COVID-19 pandemic, one of the things that our group had to do was, I would say, continually reinvent our approaches and our strategies when it came to this project. We thought that we would have everything in line and be able to move forward in one direction, and then, that didn't work anymore. So, for example, we were originally planning to do focus groups in the communities, and we're hoping we'd be able to get there. But we weren't able to do that and instead had to do phone conversations. So I think as a group, we learned a lot about adaptability, a lot about re-strategizing, and we also saw a lot of the benefits from doing things in a way that we might not normally do, or the first approach isn't always the best approach when it comes to engaging communities and working together.
In the end, we were able to do 2 small focus groups with one of our tribal councils. And it was just so enlightening to see how much information people would share with us when they were given the right opportunity. During the time of our project, we had people who were staying in Winnipeg from some of the First Nation communities that were evacuated to Winnipeg due to forest fires. I was able to discuss our project with people from these remote communities. We would never have had that opportunity otherwise. And it was a golden opportunity. We got some great information from the rural and remote fly-in communities.
Another pivotal moment for our project was realizing that we wanted to be able to have a community-based toolkit that could be used for years to come, something sustainable. This is where the purchase of the giant inflatable colon comes in. So the giant colon has a real wow factor to it. When you take it to events, it attracts people of all ages. And this was one of our key objectives when we started. Get the conversation started amongst families, among friends, talk about cancer screening, and in particular colorectal cancer screening.
I think that this project really will impact the way that we approach talking about screening. Primary population for screening is people aged 50 to 74. But through this project, we really are trying to make things multi-generational and incorporate the opportunity for younger audiences as well.
At our giant colon event, we had people before you went in the colon and when you came out of the colon. And we gave information at both ends. We found that by having purchased the iPads and have them at strategic locations as you go in the colon, partway through the colon, and when you come out of the colon, there we could have clear, simple messages that people can use in their own time. People can walk through it and see polyps, see diverticulitis. They can see different problems that can happen within a colon, and it sparks their interest, and the iPad can help explain what they're looking at and the causes, the cures.
The fact that people can see the inside of their colon, what it looks like, to have some humor associated, that what you put in comes out, eating properly, taking care of yourself. These were all value-added components and real lessons learned for our project.
We did want to infuse humor when it came to talking about colon cancer screening, and as well a bit of fun. We do have a prize wheel that talks about different trivia when it comes to colon cancer screening, coloring sheets and crayons for kids, some fun prizes like poop emoji, stress balls, toilet balls, as well as some kitchen utensils.
One of the things I learned about during this project was the importance of working with community partners, and to be finding those special people in communities who can be so helpful and who can share the information in communities. It's not necessarily the health directors, the public health nurses, the council. Often it's just community members, down-to-earth people who can just really help get that message across. The other thing I learned about during this project was how important it is to have something to really grab people's attention. We really need something like this giant colon to grab people's attention and to get them interested in what goes on in the body. I also learned during this project how important humor is, and especially when dealing with the colon and poop, and how to talk to people about poop is just to spit it out there and say poop. Our language really makes a difference.
We are really excited to be able to move forward with working in the communities from all of the interventions that we've created with this project. There's a lot of community interest for us to move forward with the giant colon events, and we're already getting a lot of requests and excitement around it. So we would just like to thank CPAC and everyone, all of our partners, for the support in this project. And we really look forward to sharing the future success of our project.